Stevens-Johnson syndrome, or SJS, is a rare but severe and potentially life-threatening reaction that affects the skin, mucous membranes, and internal organs. When SJS affects the eyes, it can lead to significant and long-lasting complications. This video will explore the specific impact of SJS on the conjunctiva, the delicate membrane lining the inner eyelids and covering the white part of the eye. SJS is most commonly triggered by medications. Antibiotics, anticonvulsants, and nonsteroidal anti-inflammatory drugs, or NSAIDs, are frequent culprits. Infections such as herpes simplex virus and mycoplasma pneumonia can also, though less frequently, cause, essentially, the body's immune system overacts to these triggers, leading to widespread inflammation and tissue damage. In SJS, the immune system mistakenly attacks the body's own cells, particularly keratinocytes, the main cells of the epidermis and mucous membranes. This attack leads to cell death and separation of the epidermis from the dermis, creating blisters and erosions on the skin and mucous membranes. When SJS affects the conjunctiva, this process results in inflammation, ulceration, and scarring. The conjunctiva may become severely inflamed, leading to pain, redness, and excessive tearing. Damage to the conjunctival cells can disrupt the normal tear film, causing dry eye and further irritation. In severe cases, scarring can lead to symblepharon, where the conjunctiva adheres to the eyelid or eyeball, restricting movement and potentially affecting vision. Stevens-Johnson syndrome is a rare condition. Estimates vary, but it's thought to affect about 1 to 6 people per million each year. However, it's important to remember that this is a serious condition, and prompt recognition and treatment are crucial to improving outcomes. Anyone can be affected by SJS, but certain factors, such as having a weakened immune system or a history of allergic reactions, may increase the risk. When SJS involves the conjunctiva, the symptoms can be particularly distressing. Patients may experience intense eye pain, redness, and a burning sensation. Excessive tearing or conversely severe dry eye are common. The eyelids may become swollen and crusted. Light sensitivity, or photophobia, can make it difficult to be in brightly lit environments. Blurry vision or decreased vision may occur, indicating more severe corneal or conjunctival involvement. It's important to seek immediate medical attention if you experience these symptoms, especially if they are accompanied by skin rash or blisters. Diagnosing SJS involving the conjunctiva relies heavily on clinical examination. A doctor, often an ophthalmologist, will carefully examine the eyes for signs of inflammation, ulceration, and scarring. A detailed medical history is also essential, focusing on recent medications or infections. A skin biopsy may be performed to confirm the diagnosis of SJS by examining the affected skin cells under a microscope. Specific tests, such as tear film analysis, may be done to evaluate the severity of dry eye and other related complications. SJS exists on a spectrum of severity, with the extent of skin detachment being the key differentiator. Stevens-Johnson syndrome, or SJS, involves less than 10% of the body's surface area. Toxic epidermal necrolysis, or TEN, involves more than 30% of the body's surface area. There's also an overlap category, SJS-10, affecting between 10 and 30% of the body's surface area. Regardless of the classification, eye involvement can be severe and requires prompt and specialized care. The primary goal of treatment is to stop the offending medication or treat the underlying infection. Supportive care is crucial, including pain management, fluid and electrolyte balance, and wound care. For the eyes, treatment focuses on reducing inflammation, preventing infection, and promoting healing. This may involve topical corticosteroids to reduce inflammation, artificial tears to lubricate the eyes, and antibiotic ointments to prevent secondary infections. In severe cases, amniotic membrane transplantation may be necessary to promote corneal and conjunctival healing. Surgical intervention may be required to address complications like symblepharon or corneal scarring. While it's not always possible to prevent SJS, there are steps you can take to reduce your risk. It's crucial to inform your doctor of any allergies or previous adverse reactions to medications. When starting a new medication, be vigilant for any signs of skin rash or mucous membrane involvement. If you develop any suspicious symptoms, seek immediate medical attention. Genetic testing for certain predispositions to drug reactions may be considered in some cases, especially before starting medications known to be high risk for triggering SJS. The prognosis for SJS involving the conjunctiva varies depending on the severity of the condition and the promptness of treatment. Mild cases may resolve with minimal long-term complications. However, severe cases can lead to significant and permanent vision impairment. Long-term complications include chronic dry eye, corneal scarring, and symblepharon. Recent research focuses on developing new treatments to reduce inflammation and promote tissue regeneration in the eyes. Studies are also exploring the use of targeted therapies to modulate the immune response and prevent further damage. Ongoing research aims to improve the long-term outcomes for patients with SJS and minimize the impact on their vision and quality of life.